everybody. Thank you for inviting me to speak here, and thank you for sharing your heartfelt story. It's an important reminder of why we're all coming together today and what we're working towards, trying to help people suffering. Today I'm going to be talking about the history of Meniere's disease, looking at different surgical management strategies for Meniere's disease that have been tried in the past 150 years. I have no relevant financial disclosures. The objectives. I'm going to talk about some historical accounts of individuals who may have had Meniere's disease, a brief history of Prosper Ménière, and reviewing a kind of timeline of different surgical therapies that have been trialed for Meniere's disease. A couple early descriptions of Meniere's disease. This first one is about Martin Luther, who's famous for the 95 Theses. In 1527, he described having roaring tinnitus in the left ear with a state of sickness and collapse followed. After a night's rest, all the symptoms subsided except the tinnitus. Similar attacks with increase of the tinnitus and vertigo seized him at irregular intervals and distressed him extremely. He thought that the devil was chasing him, and he was so frustrated he was known to throw his inkwell across the room. Sounds like a possible description of Meniere's disease. Another notable historical figure who possibly had Meniere's disease is Jonathan Swift, a famous author from the 18th century. He said, "I got my giddiness, then I got my deafness, and these two friends, one or another, have visited me every year since, and being old acquaintances have now thought fit to come together." Descriptions of vertigo have been present in medical literature as far back as medical literature exists. In Egypt and Greece and Rome, dizziness and vertigo have been thought to be due to a seizure or stroke and related to changes in blood flow in the brain previously. That was until Prosper Ménière came around. He was born in 1799 in France, and after medical school, was eventually appointed as the director of the Institute for Deaf Mutes in Paris, despite having no prior training in otology. He died in 1862, just 1 year after his famous contribution to otology. He was a bit of a Renaissance man and had many interests outside of otology and medicine. He published multiple papers about orchids and was a lover of the opera and literature, and also published on the historical understanding of medicine from Greek and Latin poets. His landmark presentation, for which he's famous for, was in 1861. He presented to the Imperial Academy of Medicine. He argued that vertigo and hearing were linked to each other and could result from inner ear disease. This was a dramatic departure from the previous understanding of vertigo as related to problems in the brain. As evidence, he described several cases, vertigo and hearing loss happening after penetrating ear trauma. There was a young girl who had vertigo prior to passing away, and on autopsy, they found blood in her labyrinth and inner ear, but none in her brain. He described a symptom complex, which is now known as Meniere's disease, and saw a number of patients who experienced fluctuations in hearing loss, tinnitus, and dizzy spells, and he described how after the hearing was gone and the fluctuations decreased, patients no longer seemed to experience vertigo, which is similar to how we think about Meniere's disease often burning out. This quote will lead us into the next section talking about treatment for Meniere's disease. The number of treatments available for a condition is inversely proportional to the success of those treatments. I first heard that from Daryl Brackman, a giant in our field, and I think it's appropriate in Meniere's disease. We have, over the past 150 years, tried many different things, and currently there are many different treatment options available, and none of them are especially successful in everybody. So what did people get in the time of Prosper Ménière? Medical treatments included quinine, dyspeptic treatments, and iodine of potassium, as well as taking Turkish baths or being exposed to sulfur water. Procedural treatments included bleeding or leeches, a aceton to the neck to produce pus to balance the humors, or moxa, which is an ancient Chinese remedy of burning cotton and placing it close to the skin to balance heat and cold. Ménière himself didn't much believe in these treatments and said it was, to paraphrase, kind of a travesty, and often the treatment was worse than the disease. Looking at the medical literature moving forward, one of the first major textbooks, Principles and Practice of Medicine by William Osler in 1900, not many changes. He still recommended iodine, potassium, salicylates, and quinine. Another textbook from the early 1900s by Edward Dench recommended bloodletting. Considerable blood should be abstracted from the mastoid region by means of a wet cup. Bloodletting is permissible when the attack is of unusual severity. Wet cupping is making a cut in the skin and then putting a negative pressure cup to draw blood out. A number of early surgical attempts at Ménière's disease are summarized here. Perry divided the eighth nerve intracranially by a middle cranial fossa approach, often leading to facial paralysis and several mortalities. Crockett removed the stapes, which led to deafness. Milligan and Lake opened the semicircular canals and instilled an antiseptic, an early attempt at a labyrinthectomy. Babinski, famous for the Babinski reflex among many other advances in neurology, advocated for lumbar puncture and said it was moderately successful. Jenkins would decompress the horizontal semicircular canal and similarly said it was moderately successful. Another text from the time, 1914, by Ballinger, recommended pneumomassage, or suction of air in the ear canal. This relieves pressure upon the foot plate and can be performed by placing a rubber tube from the mouth into the ear canal and sucking and blowing intermittently. This idea lasted for many decades and actually led to the development of the Ménière device, which was used several decades ago and fell out of favor. And another textbook, Dr. Ballin recommended cold compresses, sponge baths, an early mention of the importance of diet in managing Ménière's disease. He recommended avoiding alcohol, tea, and coffee. He injected potassium iodine into the tympanic cavity through a eustachian tube catheter and electric treatment to the head. Electricity was used for a number of different medical treatments at the time, and it was kind of in vogue and used in most medical disciplines. They would instill low current electricity across the head, and it was said to be moderately successful. Portman in 1926 had the first description of an endolymphatic sac surgery. Here are some diagrams from the original publication demonstrating a mastoidectomy being performed with a gouge. The surgical steps are similar to how endolymphatic sac surgery were performed until today, with decompression of the sigmoid and posterior fossa plate, and Portman advocated for opening the endolymphatic sac with a needle. Walter Dandy was a famous neurosurgeon who had many contributions to the field. He advocated for eighth nerve section for intractable Ménière's disease. This was successful in treating vertigo episodes, and hearing could be preserved in many cases. Bilateral nerve section led to Dandy syndrome, or bilateral vestibular hypofunction, which can be fairly debilitating. And in his first 400 cases, there was only one reported death. Interestingly, in his text, he described doing a suboccipital approach under just local anesthesia in the majority of cases, a little different from today. A number of other destructive procedures were proposed for treating Ménière's disease. Wright did a trans-tympanic trans-oval window injection of alcohol. Mollison injected alcohol directly into the labyrinth. Cawthorne did a transmastoid labyrinthectomy. Goodyear opened the horizontal canal and scraped and cauterized the membrane. And Day did a similar procedure using electrocautery to neutralize the inner ear function. An interesting paper from 1948 advocated for division of the stellate ganglion and sympathetic trunk, as well as the vertebral artery. The authors said, while it may be risky and potentially cause a stroke, the risks were low because most Ménière's patients were young and healthy. The other authors at the time disagreed with him, and the sympathetic neurectomy was popular for a number of years, but the medical literature appropriately did not support his advocacy for a vertebral artery ligation. Several doctors in 1951 were doing the first transtympanic injections. Currently we do transtympanic injections of corticosteroids or gentamicin for treatment of Ménière's disease. Back then they were injecting cocaine, tetracaine, and alcohol. They described patients getting severe dizziness 20 minutes after the injection. Medical literature was not as rigorous in its standards back then. I wanted to put a direct quote and picture of the results section of their paper here. It says, of the 37 patients selected for injection, good results were obtained in the majority. And that's it. A frontal lobotomy was in vogue in the middle of the 20th century. There's a case series of 20 patients who had tinnitus, many of whom were reported to have Ménière's disease. A frontal lobotomy is a procedure to destroy the prefrontal cortex. There was one death, 8 people improved, and 11 had no change in their tinnitus. There was a nice quote from this that I'll summarize, where the authors described the patient said the tinnitus was no better, and she had behavioral problems and inhibition problems, but she was happy because it didn't bother her that much anymore, and the husband was happy because she didn't bother him much anymore. This is a nice diagram from Brian Ward's paper describing several endolymphatic surgeries that were done in the 1960s. I encourage anybody interested to look it up. There are some interesting and clever ways that physicians at the time tried to manage the dilated endolymphatic space that we know is responsible, or at least a part of Ménière's disease. In 1962, William House described the endolymphatic shunt. This is a modification of Portman's endolymphatic sac surgery before, where similar surgical steps were performed, and instead of just opening the endolymphatic sac, a foreign body was placed into the endolymphatic space to keep it open. He published on this a number of times and described good success. So how does Ménière's disease relate to the moon? Alan Shepard was the national hero when he was the first American who was sent to space. Unfortunately, 2 years later, he developed Ménière's disease, and he suffered greatly. Medical therapy, including diuretics and niacin, were ineffective. He did his research and heard about Dr. William House, and in 1968 had a shunt procedure done. 6 months later, he said he had no more symptoms, and he ended up flying to the moon with Apollo 11 several years later. That concludes my very brief history of some of the surgical treatments for Ménière's disease. There are many more. If you're interested, you can dive deep into the history. I think it's very interesting to look at where we've been in the past in treating this challenging problem. It puts in perspective, people back then were doing their best. Currently, we are doing our best. 50 years from now, we're going to look back at this time and think, why couldn't we do better?